Seventh day today. Dozen nurses in public hospitals remained unmoved, even as the High Court extended orders prohibiting the strike to Tuesday next week. Salim Bilu tells us more.
It is a court order that was first issued by the High Court on Wednesday, prohibiting the health workers from continuing with the strike, following an urgent application by the Attorney General until the hearing of the case filed is heard. Health workers defied the order and continued with the strike that has seen most county hospitals paralyzed for the 7th consecutive day. According to the workers' union, they were yet to be served with the court order.
What is happening is that we have just been hearing about a court order.
Monday morning, however, and the Industrial Court extended the orders until 24th December 2013, when the case comes up for hearing. While issuing the order, Justice James Rika said the time will allow the petitioner to serve the respondents.
We've been babysitting the employees, and if you babysit and the child keep on giving you problems, breaking glasses everywhere, you take the baby back to the mother, which is what we've done.
So let the mother speak. If I'm the mother or the father. No salaries will be paid to persons who have absconded from work.
Nairobi Governor Evans Kidero has since directed the County Public Service Board to hire health workers to replace those who are on strike. Kidero ordered the board and the county's Human Resource Department to immediately recruit 60 doctors, 47 clinical officers, 436 nurses, 12 radiographers, 20 lab technicians, and 12 pharmacists.
All those who would want to work with the county governments are encouraged to apply for the positions that will be advertised.
The striking health workers are demanding that the devolution of public health workers' pay be suspended until a health act governing the devolution process is put in place, guaranteeing their terms of service.
We would like the health bill to be published by end of February in Parliament, and if possible, enacted into law within 6 months.
It's insincere to say there's no law, because we have the County Government Act.
Section 138 of the County Governments Act clearly indicates that no one will be paid anything less, including allowances, including whatever, than they were getting before.
The hardline stance taken what may see many more Kenyans who rely on public health care continue to suffer as the access to medical care remains inaccessible. Salim Bilu, Monday Special.
Well, the health crisis is still biting in public hospitals. In studio tonight on Monday Special, that is what we're talking about. Keep the conversation going on 22422 or on Twitter using the hashtag Monday Special KE. I'll read two of them. One from 22422, here from Molo Rael saying, are medics above the law? If they can't honor the court, who will listen to them? Then when you have from Machako says, I am a Kenyan citizen and I fully support the health workers strike because they have a point. Remember, they are indispensable and are actually also fighting for the Mwananchi. Well, is that so? In studio, I have James Ongwae, who is the governor, Kisii County, also the chair of the Labour Committee of the Council of Governors, joining us. Thank you for making time for us. I have Dr. Nelly Busire, the only lady in this panel, and that doesn't scare her, she has assured me. She is the chairperson, Nairobi branch, the Kenya Medical Practitioners, Pharmacists and Dentists Union. On my left, of course, I have Cabinet Secretary Dr. James Macharia and Governor Ahmed Abdullahi from Wajir County. Thank you very much, all of you, for making time for us. I'll start with you, Dr. Nelly. The threat has been made already. If you don't resume work, governors will now look for other health workers.
Well, I think once you sack us, then we are no longer on strike. And I think the governors are free to hire. The reason why we are trying to put structures in place is really because we want to get rid of this kind of arbitrary sackings. We want a policy in place to govern this, to stop demoralizing health workers, because at the end of the day, as we said, when we exodus out of the public health system, the person who suffers is 90% of the Mwananchi that cannot afford private care. Yes.
Very briefly, as you go into the debate, very briefly.
Yes.
What is your problem really, the health workers? What is the problem?
Structures. The Ministry of Health has been plagued with lack of structures for a long time. And the ones that have been there there has not been any political goodwill to actually make them work. So we're at a point where already the first process of devolution has been run without structures. And this is just the beginning. So can you imagine how much worse it's going to be if we don't stop this process now and ensure that whatever is remaining of devolution of health is done right?
And who do you blame for that?
Well, I think all of us. I will say all of us. All of us meaning the politicians, the policymakers, the Mwananchi, and even healthcare workers.
Is that what is going on, Governor?
Well, I don't think so really, because we're inheriting whatever structures we had on the ground. All that's really changing, and this is as a result of the new constitutional dispensation, is the alignment of really the reporting lines and the supervision structures. Every hospital in every part of this country had structures before the county governments came into being. And there's additional structures that came through the chief officers and the CECs and the deputy governor and the governor, who are all on the ground to see to it that there's service delivery. If the structures that we inherited were wanting, then I think it's not good enough reason to strike. We can have conversations about how to improve the same. Yeah.
Well, I think it's once again a bit insincere to say that we are going to strike because of lack of structures, because the Constitution was very clear. It said that come July 2013, the health sector, the health services will be devolved. And so the budgets, the planning, everything was done on that basis. And we all knew about it. However, to make sure that there was sort of a settling down period, the governors, together with the executive, agreed that we shall have a 6-month period to make sure that indeed everything is sorted out and the transition will be fairly smooth. And that's what happened. And there'll be no problem at all, but all of a sudden we hear there is a lot of anxiety that if workers are taken to the counties, in terms of salaries, there'll be a problem. Like Governor said, nothing is changing. Those employees are actually there on the ground.
I believe when you're saying the national government and the county governments, Governor, you're referring to the summit. Were the health workers involved in that when this decision was being made?
I think mainly what we actually saying, if you look at section 138, it says that all their terms and conditions of service will continue as they are. They cannot be improved, they cannot be taken downwards, they can only be improved upwards. The Constitution is very clear. And I would want to restate what my colleague Governor said. We as governors have not interfered with the institutional framework that was down on the ground. What most of us have actually done, and we'll be able to indicate that in the course of our discussions today, is we have improved on that institutional framework completely. I will give you examples. What the governors, for instance, in my own county, the medical director is still in charge, who was there. The medical superintendent in our largest hospital is the one still in charge. The institutional framework, whether it was on accounting, on human resources, on procurement, is still in place and is still managed by the hospital board that was there. So the only issue that comes in is the reporting relationship. Probably if there is any indication of weakness, then it would be that probably the level and caliber of the governors that are in place are not good enough to supervise them. That I cannot account for that.
Why are you involved? Do you believe you were involved?
I think that has been the bone of contention. There was no involvement. Okay. Maybe at the level of central government within Afya House, at the ministry, there may have been consultation, but at the end of the day, the person on the ground had to be involved. We can understand in the past we've not had some structures that represent the person on the ground, but at this point we've had the unions. They have been very vocal, and I think they really should have been involved.
Were they involved or not earlier?
They were not involved.
So the minister here is saying he doesn't understand why this is coming now. This is coming about 6 months later. Why now?
I think the cabinet secretary came into office, and our union actually paid him a courtesy call, if I'm not wrong. We introduced ourselves, we said who we are, and we said we would really like to work together. One of the things we're very happy about, there was a lot of resistance, I think, as he was coming in that, people in the medical field felt that they wanted a medic to run the department and all that. But at the end of the day, what we were promised is that we're looking for people to deliver. Okay, because this is purely administrative. And when it is administrative and somebody's task is mandated to be administrative, then you really want to bring in all the collaborative efforts so that they understand where you're coming from at the clinical aspect to help this service delivery to go forward. Now, let's look at even a few things like the policy document and the health bill that's currently being drafted. I think it's back to the Cabinet Secretary's office because there was no involvement. And that even his office acknowledged. As it is right now? Is there any drafting?
Let me clarify. I'm saying, more than 6 weeks ago, we actually shared a draft policy with the unions.
That's a fact.
Yes.
And since then, we've not received any single input of feedback. Nothing whatsoever.
This was 6 weeks ago, at the point at which we raised the alarm and said, hey, how do we have a document which were never involved in the original drafting?
You were only involved after you raised the alarm, or you?
Well, actually, what happened? The Cabinet Secretary actually summoned the union officials to his office. He actually called for a meeting, and he said, we have a policy document here. We would like you to look at it and give us feedback. Our question was, at which point was it drafted without our involvement to begin with? Because what we felt was that we were being called to rubber stamp a document. And what we would have rather have had was involvement from the point of developing these documents.
You see, Hussein, if invited or consulted on a document which is not complete, which is draft, you are being asked to give your input so that before the final document is completed, it reflects your views. That's exactly what we did. That document is not just the unions, it will go to other stakeholders. It has got the governance as well.
In fact, the document hasn't even come to us.
It hasn't come to us.
We are going to give our views. So the broad argument that they have not been consulted is not correct. But again, one wonders whether are we dealing with the document of policy here, or are we dealing with the initial institutionalization of the health function in the counties? I think the question for the doctors is the initial institutionalization of the health function in the counties. And basically what we have done is that this function has been in operation for the last 50 years that we have been independent. And as governors, we have not interfered with that function at all. We have allowed the institutional framework that was there, that was put in place by the Ministry of Health, to continue being there until the document is finalized.
You want the payroll to still remain with the national government?
Yes.
Why?
I am actually very impressed that Governor Ongwae has made it categorical for what he intends to do for the healthcare workers in his county. And that's very noble. But in the other counties, our workers have been through a very difficult time. Not every governor is as noble as he is. We have had people who have actually generally been sent back to central government for redeployment, categorically because they did not belong to the right tribal grouping. I don't think county governments were meant to propagate tribalism. So if that is the case, then does it mean you're making me as a health worker give service to someone because of who they are? I don't think that's right. I'm supposed to give service to everybody. So when I'm not allowed to work in a certain county because I don't belong to that, and it has happened, and nobody has intervened, so what worse could happen?
At the end of the day, when it's fully devolved, health services, this is for the Mwananchi who wants to know.
Absolutely.
Who will have the power to fire and hire?
Well, as of now, I think from 1st of July, these workers belong to the counties. I think that has to be made absolutely clear.
Yes. That's true.
So why do you want the payroll to still remain with the national government?
We want structures. We want that payroll to go to the counties when we actually have proper structures. Let me give you an example. In training, we have to go through a year of internship, okay? As it is right now, we don't have a document that talks about internship per se. What will happen to internship? Because the facilities the interns work at for that period of 1 year are county facilities. But this function of internship is categorically responsibility of the Ministry of Health and the medical board, okay? So they have always worked in tandem to ensure that this is done right, because this is about licensing of this individual once they're out of medical school to be fit to practice in this country.
Is that provided for anywhere? Well, is that going to be catered for anywhere?
And Hussein, before I answer that, just getting back to the issue of people being fired, maybe for being in the wrong counties, I think we have to be, specific in cases of point here. Why I say that is because no one is above the law. Governors are not above the law. I would want to assume that even in the previous system, disciplinary action should have been initiated by the direct supervisor. So if someone had issues, it's not Afia House that would know that that person had issues. It will be the direct supervisor on the ground. So I have diverse staff in my county. It's only 4 doctors who've joined the strike. Everyone else is working. I've not had any issues of anyone who's been unfairly treated.
Yeah.
And I think, sometimes, some of these things that we say to make maybe the case stronger for the union, we're also wondering as governors in which counties are these things actually happening. Just to add on the issue of the policy document. I've not seen it myself. We're waiting for the same. We would want to see what health policy and what act comes into being. But at the end of the day, it must not be ultra-biased to the Constitution. And the Constitution has made it very clear that health is a devolved function. And in fact, Article 191(3) of the Constitution has also made it very clear that to the extent that a function is devolved, legislation at the county level, in as far as it does not contravene general standards and nationwide standards and norms, is actually superior to any legislation that will be made at national level.
There's a window period for devolving services, 3 years. I think one of the things the doctors are asking for is what is the rush, and if you're devolving this service, part of which is already devolved right now, why can't we have legislation to have the structures?
Yes.
I think if you go to, Article 187 of the Constitution, it clearly says that if you devolve a function, the resources of that function must follow that function. And that's what happened, because we decided through the TA actually liaising with the county governments that counties were ready to take over that function. And the summit did meet, and it was agreed unanimously that everybody was ready to take on the functions. So obviously after the function was devolved, we had to also follow the resources, meaning the payroll. That's why Monday actually went, starting from July. And therefore, this issue about can it be reversed actually does not arise. But let me clarify one point which was really about the training, because I'm sure most of the health workers are very concerned about the training aspects.
Right.
And career development. Now, we agreed that going forward, the training continues to be at the national government. Training, policy, research. However, to supplement it, to make sure that the issue about devolution is taken into account, we offered and committed to the unions that by end of January, the Public Service Commission will come up with a very comprehensive policy, which then will be used to enhance the policy in the Ministry of Health. And we said it will be done over Christmas and by the end of January. They still do not want to accept that.
Let me go straight to some points here that people have been raising. Somebody here, Agnes from there, says we have not refused to go on duty. I believe she's a doctor or health worker. But we're asking Dr. Macharia whether we are going to be deducted allowances. Where is this fear coming from? And why are doctors from a section keeping and health workers, they keep saying this, that there could be some reductions. Don't you trust county governments to pay you?
That wasn't even a fear that we had to begin with until the last 2 weeks, when we have actually had circulated documents that have come from about 3 counties that have they actually payroll structures from the county. And they have actually showed a massive reduction of up to 40% of what they are going to earn. I have seen this document, so I'm not making this up. Now, this document, you know what
from where? Like, the documents are from where?
They actually, when we tried to find out, eventually nobody wants to own the document, but categorically the people on that payroll belong to specific counties. Okay, and it's not just for healthcare workers. It's actually across the board for the civil servants. So we're not just saying this because it's only us who are affected. But here is my concern, that for every public servant, you belong to a certain job group. That does not change.
Yeah.
Okay, and healthcare workers are also categorized exactly the same way. The only thing that actually makes the pay package for the health worker to be a little better maybe than someone else in their job group is the allowances. And these allowances have strictly been pegged by the unique nature of the healthcare workers. Okay, the kind of work we do, the kind of hours we work. Those were some of the things, because these allowances did not come overnight. They were developed long before the gentlemen here were in office. Okay, and they are slowly, we've been negotiating them over time. But one thing that we've always been told, allowances are just that. They are allowances. They can be taken away at will.
So you
we've heard from the SRC that there's no civil servant who should earn more than 40% in allowances of your basic salary.
Okay.
That ultimately is reducing this package to something very meager, and that is one of the things that is coming from the county governments, and that's the same thing we're saying. Where is the policy at the end of the day that governs these things? Because if it is centrally done, then at least as a unique cadre of staff, because whether we like to admit it or not, healthcare workers are not just any other civil servants who go to work Monday to Friday, 8 to 5.
Okay. I'm afraid we're running out of time. We have to be a bit fast in our answers and brief. There's some genuine concern here. If a county decides later on, and this is something I would ask you, and you governors, if a county decides at some point to just reduce the pay for health workers, is there anybody who can stop the governor from doing?
Probably let's answer first the basic issue that she has raised, that there are allowances that have been reduced. First and foremost, county governments have not taken over the payroll. The payroll is being run by the ministry. So if some workers have seen a payroll from a county, I think they are not being honest. Secondly, we have indicated about Section 138 of the Constitution, which says that all the terms and conditions of service of all the seconded staff, not only health staff, can only be increased upwards. And that is in the Constitution. You cannot reduce, even if you wanted to.
As a governor?
As a governor, because it is in the Constitution. It says you cannot reduce, you can only increase. It is there, Section 138. So basically, what is happening is that in the course of putting forward their case for the strike, they are dealing with probably innuendo and propaganda. And those documents cannot be related to even one particular county at all. They can't. If you ask them which county, they will not tell you.
I would support that because other than the counties, also there was an article which said that there was a letter which came from Ministry of Devolution and Planning. I can confirm it was a fake because nothing of that sort exists. So what we are saying, there's so much propaganda to back up the strike.
Okay, we're going to take a short break now, and we're going to go on the debate after this break, and the phone lines will be open, so be ready to call in live and ask your questions. Stay tuned.
For over a decade now, Royal Media Services has been at the forefront in uniting Kenyans through information, news, and entertainment. And to celebrate our unity in diversity, Royal Media Services presents the Grand Celebration of the Year on 22nd December 2013. Join your favorite presenters from Radio Citizen, Inoro FM, Radio Ramogi, Mulembe FM, Musie FM, Muga FM, Chamgei FM, Egesa FM, Wemwaro FM, Bahari FM, Vuka FM, and Sulu FM as we join hands with 21 different churches in praise, worship, and thanksgiving as we raise funds for the Lord at St. Mary's Osorongai Ngenyelil Church, Tarbo in Uasin Gishu County. To bring the house down will be Kenya's top gospel artist, Solomon Mkubwa, Muigaiwa Joroge, Joseph Shisia, Purity Kateiko, Marion Shako, Faith Makena Materi, Elizabeth Mudoni Moora, Maureen Awor, a.k.a. Nya Jerusalem, Rebecca Thomas Mungari, Winrose Chepkorir, Douglas Kiforo, and Selina Sitati. Royal Media Services, promoting unity in diversity.